So today we'll talk about clinical concepts of manual physical therapy. There's a lot of manual physical therapy techniques out there. You could do mobilizations, dry needling, cupping techniques, soft tissue mobilization, instrument-assisted soft tissue mobility, muscle energy techniques, and there's a bunch probably that I forgot. But what I want to talk about today is joint mobilizations, more specifically grading of joint mobilizations. All right, so traditionally we have grade 1s, 2s, 3, 4s, and 5s. In school we were taught grade 1s and 2s are used to decrease pain, and 3s and 4s and 5s are used to improve range of motion. All right, so it would look like this. So for whatever reason you choose a joint that you want to mobilize, and you just use the grading that we would think that's appropriate for the patient's goals. All right, so you choose a joint. In this case, it's a lumbar spine. I would say I'm an L4, and I would just do grade 1s. So grade 1s would be small amplitude oscillations. So grade 1 is before any tissue resistance. So it's very light. So the only difference with grade 1s and 2s, they're both before tissue resistance, but grade 2 would be large amplitude. So it's a little deeper, it's still before tissue resistance. Okay? Now grade 3s will be another large amplitude. This is into tissue resistance, and traditionally it starts at 50%. Okay? Grade 4s would be the same amount of 50% resistance, or starts at 50% resistance, but large amplitude. I'm sorry, that's small amplitude. Okay, so that's grade 4. That will be my grade 4. All right, that's typically how it would look like. Now, as far as grading of manual physical therapy, of joint mobilizations, I can argue that if it's the appropriate load for the patient, grade 1s and 2s can and will improve range of motion, and at the same respect with grade 3s and 4s can and will improve pain if it's the right load appropriate for the patient. Now, as a patient, you need to talk to your physical therapist if the joint mobilization is appropriate for your care, and as a physical therapist, you need to rationalize the amount of load required for the patient to achieve the goal that you would like to meet for your patients. All right, so let's talk about it. Reach out if you have any questions or concerns, but I'm probably going to make some videos about mobilizations so all of us can interact and talk about clinical concepts of manual physical therapy. All right, see ya.